Hello children of the universe and welcome back to my channel, Makeup and Science. My name is Darky and today is my 1 week post-op surgery update. So I try to take as many recordings whilst I was in hospital, so I'm just gonna have like this short compilation of what I recorded, and I might jump in a few times to just edit over it, like with some more details or like what I learned afterwards. I'm sorry if you can hear the kids in the background. There's nothing I can do about it. Anyway, yeah, I'm just gonna come in and edit like on top of it with when I need to. So I might just pop in and out sometimes. But yeah, I do have a prelude video if you're interested in watching that. Also, my channel is normally about makeup and science here and there. So yeah, stick around if that interests you. Check out some of my other videos. And if you want to follow me on my plastic surgery journey, don't forget to subscribe, like this video, and leave a comment down below. If you have any questions, I will answer you, and might even, end up including it in videos. So that's cool. All right, please enjoy. Hi, so today is the day of the surgery, and this is like what I'm wearing. I'll show you better later. I just got a maxi dress from Killstar and I'm wearing my robe because it's cold and no one's gonna see me, and heading to the hospital now. So I'll show you more stuff along the way. Okay, I have been admitted and I'm in the bathroom right now because I need to have my pre-op shower. And this, I'll give you a little tour. So this is my room. I'm gonna make it bigger, there we go. And it's private, so yay. It's quite nice. I got my own locker stuff. I've got my things down here. I'll show you what I got in my bag later. And then this is my private bathroom. So yeah, this is like my dress that I bought for surgeries. It is a floor-length maxi dress from Killstar, and I bought it because like I can wear it bra-free. It's elastic, very comfortable, and I can sleep in it and stuff, so I like it. And it's just, my little taste of gothicness on top of it all. Yeah, so what did they do when I got here? Obviously the normal admission stuff, and I'm just going to my shower. They are going to measure me for TED stockings, and then the surgeon's going to come in and do all his markings and stuff. And yeah, I don't know how much time I'm going to have between now and the surgery to record, so I'll do what I can, and I will see you on the other side. Okay, so this is my bag. I just took my dress off because that's post-op. And I've just got all my toiletries in here. It's got all my skincare, my toothbrush stuff, and I don't even know if I'm going to use this, but I brought it anyway. I bought this book for some light reading. Yeah, I just want to collect some more science books to read. So I'm starting off with Stephen Hawking, A Brief History of Time. So I'm going to put that on my bedside here. And as you can see, I've also got my ColourPop lip mask. I actually really like this. It smells really good and it does last all night. Like I wake up with it still on my face. So there's that. And whenever I go to hospital, I always bring a blanket with me because hospital blankets suck. So I bring my own, and I also bring my own pillow. So that's going to stay in the suitcase for now because, bringing the bed into the theatre, we're not going to have my own stuff. So, and that's pretty much it for now. Hopefully I don't have too much longer to wait, and just got my hair up high because, it's going to be lying on my head, and I do not have time to look pretty. Okay. Wish me luck. The pain is intense. I just want to be put back to sleep so I don't have to feel this pain. I can't sleep, so I figured I'd just record something. So far it is about 11:35 p.m. right now, and the most annoying thing after the 360 is I am stuck on my back in like a banana position. So this is like the worst position for a spinal surgery recipient. So like part of me I really need to roll over or lie down, but I can't do either because I'll pretty much break the stitches. But cool thing, I wonder if I can actually show you. Actually, no, I can't pull the blankets back from my legs, and I don't want to pull them back because then I can't put it back on. But I have like I got the normal Ted stockings on. Actually, what if I do that? I don't know. Anyway, I have the normal Ted stockings on, which are for compression and getting blood back to your heart. But I also have self massaging like mechanism on as well. So it wraps the leg and fills with air on and off. So it's just like gently massaging. Oh my God, that's really hurting to talk because I'm stiffening my muscles. So yeah, it's pushing the blood back up to my heart so I don't get blood clots. Also, I had like a massive injection of heparin. Actually, I wouldn't say it's massive. It's probably 2.5 milligrams because that's, I think, the standard dose for anticoagulation in hospitals. So yeah, but this is all the first time I pulled the blanket back and saw my body. Hold up. Just gonna cover the opening. So this is the compression suit. My legs, I've never seen my legs this slim. And wait, let's zoom this out. So I'm just going to cover my privates. So obviously I got the suction for all the blood and fluid to come out. That's and my catheter for my urine. And this is the bodysuit. Wow, look how flat my stomach is. And my bum's going in. Well, not bum, but, you know, my side of my thighs. They're not so giant. Usually I'm, you know, really bulging out. So it'll be good to see when I stand up. I don't know if I can get my boobs in here. Hold up. Boobs. Oh, wow. I actually have maybe shapely boobs. This here, these cords here, these are the local anesthetic drips, and they're literally under the skin and running all the way down my abs and just dripping continuous, like morphine or something as a localized anesthetic. And I'm still in pain even with that. So the reason he does that is so that you're on less analgesia. So opioids suppress the nervous system, which means it slows down your healing and your heart and your bowels, and it just makes everything worse pretty much. So to have a local anesthetic is so much better than having too many opioids or nerve blockers. What else do I have on me? I have this here, so that's my first cannula, and they're putting the drugs in there. And then I also have a second one where my IV hydration is going in. Oh, look at this bodysuit. It goes all the way up. So like, I guess this strap here is holding this. No. Yes? No, yes? I don't bloody know. I'll find out tomorrow. I'm gonna stop talking because it's very tiring on my upper abdominal muscles. Hi, so this is day 1 post-surgery. Nothing exciting has happened, just thought I'd do a check-in. Actually, no, I can't change it, okay. So yes. 1, I've become insomniac, so I can't sleep because of the drugs I'm on. 2, weird hallucination dreams. Okay, it really hurts to talk, so I need to take breaks to breathe so I don't hurt my abs. That's what's hurting the most, is my abdominal muscles where they were sewn back up in the center. So for 48 hours post-surgery, I have to stay on my back and slightly bent. So I can't lie down flat because that's gonna pull on the stitches, and yeah, I have to stay bent and also like sitting on my bum. I'm able to rotate a little bit like side to side, but obviously every time I move, so I need to breathe. Every time I move, you know, that hurts my abs because I'm using my abdominal muscles to move. And my legs are very heavy, so they're not much help. And, you know, I keep going between putting pillows under my legs and not putting them there, and bending my knees and trying to relax, and, you know, left, right, and now I'm just staying still and I'm trying to get some sleep. So that's it. I don't have much of an appetite. I was able to have some breakfast at 6 a.m. and they brought me lunch, and it took me like 4 hours to finish eating a tuna roll and salad. Then dinner came and I couldn't eat any of the dinner. I was just, well, actually I did have the sticky date pudding, a coffee, and that was it. I couldn't touch the main meal. So part of it's just like, yeah, I'm nauseous and my stomach hurts, like just everything that vicinity hurts. So I also don't want gas because just having gas hurts. And yeah, took some more appearance, so CLARKSON Center and Movicol, so maybe I'll be able to open my bowels tomorrow. I doubt it. Yeah, so I'll be able to get up and walk tomorrow. Really looking forward to that because I just want to get off my back so much. So yeah, if I try to read, I just pretty much fall asleep, so I don't think I'm ready to read A Brief History of Time by Stephen Hawking, and to like sort of keep my weird hallucinating dreams and thoughts at bay. I always have to have like noise in the background. So right now I've got like ABC classical music running, or like I'll have just YouTubers and like podcasts going on so that I can just like lull to. So yeah, apparently I'm moving a lot more than what's expected of me. Like, I was just shocked to come back in and see that I'd moved pillows and repositioned myself and everything. They're like, usually, you know, people on their first day post-op, you know, they can't move at all and they're very drowsy and dopey and everything like that. But yeah, I can't sleep and I'm moving a lot, so that's a good sign. I think part of it is that like I'm a chronic pain sufferer, so I am used to being in pain and just getting on with it. And the other part is maybe I just, you know, I'm healing well. I don't know. I did see the surgeon. The surgeon gave me some photos of me on the operating table. I'll just put them up here. So we've got before and after shots. So yeah, what time is it now? It is now 8:30, so it has been 24 hours since I woke up post-surgery. So yeah, not much to update on. It's really just been bed rest, that's it, and lots of YouTube. Also, I need to remember to take like deep breaths because I was under for so long. You can get pneumonia from like fluid buildup in your lungs, and like your lungs getting lazy. That's why it's really risky to stay under general anesthetic for a long time, because your lungs sort of just stop working, and hopefully like when they take it out you start breathing properly on your own. But it's sort of scary because like I've got phlegm buildup and I need to cough it out, but the cough will hurt so badly, so I asked for like my painkillers to hopefully reduce some of that pain so I can actually cough and get the phlegm out of my lungs, because I don't want pneumonia. Yeah, so that's my update for day 1 post-op. So this is the setup. This is what morning, day 2 post-op, and you can see the red stuff's the drain to my wound, and the yellow is my urine, and then those are the leg pump massage things on my legs, so they're helping to push the blood up to my heart and prevent deep vein thrombosis. And sorry, there's lots of brightness, maybe I should turn the light off. There you go. So day 2, taking the catheter out and gonna get me up to the shower. So it's gonna be the first time I stand up in 48 hours. I may faint. The pain may be excruciating. So it's a big deal. Anyway, I'll pop back in afterwards and give you an update on how my experience goes. So it's almost the end of day 2 post-op. I did get up and it was not as bad as I thought I'd be. So no lightheadedness, no vomiting, very painful on the abs, because obviously your abs are your core muscles, they hold you up. And yeah, standing up is like being hunched over like an old granny. Sorry, I lost track because the nurses came in. Yeah, so I'm bending over like an old granny, which is expected because obviously I've been sewn quite tight. Actually, I saw it in the photos, like you can still see my stretch marks that were like above the belly button. So I think where he cut off, it was like just above like my original belly button. Pulled that down and then made like a new belly button. So he told me how he did it, or how he does it. Like, he keeps the old belly button healthy, and then he sort of anchors it down so it doesn't move, and it keeps it a nice tight shape, and then just attaches it to the new hole he makes. So pretty much my belly button should look the same afterwards, because I've been seeing like on the American websites some really weird belly buttons. Like apparently they've been putting stuff in their belly button to keep the shape they want. I was like, it's so weird. So yeah, I think there's multiple different techniques for belly button construction, but Dr. Adrian Brooks does a very nice style. So yeah, I went to the toilet, had a shower, I was able to sit out of bed for a little bit. That was nice, sitting on the chair. My appetite's getting better, so I've been having a bit more food, and I took the catheter out, which was good. The massage things are off my legs, and then just then I took myself to the toilet. Like, I was busting, I couldn't wait for someone, so I did ring the bell, and then I just got up and went to the toilet. By the time she got to me, I was on the toilet, and then I got myself back to bed. But now, like, I can feel I need to cough up some phlegm. So it's like around this sort of area. there's some mucus and it hurts so much to cough. So I did just take some more PRN, like as required, you know. I can never remember what PRN stands for. Per required need, something like that. Anyway, yeah, took the buprenorphine, which is, oh jeez, it hurts to talk. Yeah, I'm just waiting for that to kick in, and then I'm going to purposefully try and cough this phlegm out because, you know, I don't want to run the risk of getting pneumonia. So there is that. And yeah, I've actually had a lot less PRNs today. So I had one tapentadol immediate release, and just now I've had the buprenorphine instant release. And yeah, then I'll have my regulars, I think, at 10 o'clock tonight, and another dose of antibiotics, because when they do the fat graft, pretty much it's dead tissue, like the fat is dead, and it needs to be washed and purified, and then he only uses like the best fat to go into a fat transplant, and then obviously to like prevent infection, I have to be on quite strong antibiotics. Even afterwards, like when I go home, I'll have tablet form just to avoid getting an infection. Oh, I could feel it. I can feel the phlegm, it's right there. I think that's it for tonight. I'll come back tomorrow morning or later in the day and give another update. So today's Wednesday. Tomorrow is just, I think, another normal day. They might be taking out these drips here, which is like the morphine that's dripping over my muscles. And then Friday I get discharged. I get to go home. My husband's quite worried about me getting up the stairs, but considering how well I'm moving already, I'm not worried. I'm just going to take my time, make sure I have support around me, and then once I'm upstairs, I'm probably not going to come back down again until my appointment on Monday. So next Monday, I'll go see the nurse, and she'll be changing my wound dressing, so the vacuum seal, and it'll be a new one put on. So I think the vacuum stays on for 2 weeks at least, and I should have a really good scar after this. I know I'm very purple. Like, I get hyperpigmentation with, like, just even with pimples. I've picked at it. It takes so long. You can see that one there. That's been there for like 2 months now. And it's just the pigmentation. But yeah, eventually it'll go away. It'll become a silver line. Like, all my stretch marks look like silver lines. And none of them are bulging. There's no keloid. So yeah, it's good. Alright. You all have a wonderful evening. Okay, so I thought I'll just like mention the not so pretty side of healing. So I ended up being able to cough the phlegm up, but it's pretty bloody. So like that's a big chunk of I don't know what, just phlegm, and there's like more on the inside. But I think, you know, that's just normal and expected because, you know, I was under general anesthetic for 10 hours, and after that, you know, it's been 48 hours of not moving, just been stuck in one position, and, you know, not taking really deep breaths because obviously I can't, and yeah, you get build up of fluids in your lungs. So I just took loads of analgesia so I could sort of try and cough comfortably, and I didn't cough violently or anything. It was still very small coughs, but I finally got it out, and yeah, it was just bloody chunks. So just going to keep an eye on that. Another thing that you may be shocked by, so like these compression suits, right, they cover, wait, so they cover down to my knees, right? It goes up the body, and then you can see here it's open. So with like every other part of your body being compressed, and the only opening being where your genitals are, it swells. So one side of my labia is very swollen and like bulging out, and because I'm not wearing any underwear, it's like rubbing on stuff, especially when the cords rub on it, or like the bed, so like getting up and down and just feeling the fabric underneath drag. That's uncomfortable. So tomorrow I might put some underwear on, like over my garment, so that like I feel more protected. But I hope the swelling goes down soon, because it's pretty gnarly. Like the skin's become quite thin because it's so engorged. Yeah, that's the gross side of this that I thought I'd share. Well then, this is end of day 3 post-op, so it's Thursday. Been out of bed. I just did a marathon around the ward. I went for 5 laps around the ward. It's like a big circle. And I'm coming back to the bed to rest because a little bit breathless. Actually, it's the talking. Like the walking was alright, but when I stopped to like chat with the nurses at the nurses station, that's when I really felt breathless. So that's good. So how am I doing? Day 4. Yeah, day 3. What happened day 3? They waited until the afternoon shift, so about 2 o'clock. We took the drips out. So these drips were like local anesthetic that was underneath the skin. They're like wires, tubes, laying over the muscles and dripping local anesthetic over like 2 parts of my abdomen and 1 part of my back. So these were removed today, so that I will just be relying on oral analgesia now. And sorry if my talking's a little bit weird. I got my retainers in, so I might have a little bit of a lisp. But yes, I'm doing really good. All the nurses are very surprised by my mobility, because most of the time people are struggling at this stage to move at all, or to walk or anything like that. So I just know for me personally, I am quite fit, and on top of that, I'm a very active person. So I think that will help. Like definitely with any surgery, it will always help, but the fitter you are, the better the outcomes are going to be for you, and obviously how you will feel during the healing process and everything like that. I also know from experience that my healing in itself is good. Like I get good scars, and I never really have any complications at all post-surgery or post-injury or illness or anything like that. So yay for me, and I'm sorry for those that don't have as good healing processes, and I wish you the best of luck, because you just need lots of TLC. Like make sure you rest, make sure you eat, drink, take your laxatives, and do what's best for you. Don't let anyone pressure you into doing anything too quickly, or like dictating how you should feel. Like the way you feel is the way you feel, and that's it. You know, do what's best for you. And that's pretty much it for today. My appetite's still low, which is fine. Like sometimes I feel icky, like I want to vomit, and other times I'm hungry, so I'm just like, whatever. I'll eat when I go home. And tomorrow, so I still haven't opened my bowels. I'm gonna ask for some sups this morning, so that hopefully I can open my bowels before I go home, because today's day 4, bowels not open. And even though I've been eating little, we don't want to have a hard stool coming out after a surgery like this. It's going to hurt a lot. So I want to have some more Movicol or Macrogel that adds a lot of water to your stool, so it comes out more like diarrhea. and it's less effort for your bowels. There's other things like Buscatoro subs, and they increase like the muscle spasms of your intestines so that you just like open your bowels without control. So that will be good compared to using my abdominal muscles to push. And yeah, and then tomorrow I'm going home. So the nurses said I should be discharged by 11 a.m. My drainage should be most likely removed because it's not really draining much. I don't really have much coming out. Like this one here. This one here has been in since yesterday morning, and I think it's just hit 100 mils, or it's still under. Yeah, it's still under. So today is the 5th, and that was put in pretty much 24 hours ago, and it's barely hit 100 mils. And that's connected to my thigh down here, and there's like a padding there, so it's nice and cushiony. But then here I've noticed I have some like purple bruising, and it's almost excoriated, so I'm looking forward for that to get removed, because obviously I don't want damaged skin. I don't want any extra wounds. And then these two here, these darker ones, are the vacuum tubes, and that's the vacuum seal for my abdominal wound. So the abdominal wound dressing is staying for 1 week, so I'll go back on Monday to the surgeon's like personal nurse, and she'll do my wound dressings, and then that will stay on for another week. And I think it depends on how I'm healing, if I get it again for a third time, or if that's it. It's really good. They're waterproof, and obviously I don't think there's any stitches under there. I think it's just glued and then this seal on top. So I should have a very pretty scar at the end of all of this, which is always a bonus. I'm very hyperactive now, so I've been very sleepy all day. I haven't really needed any PRNs either. I did take just the buprenorphine after we took the drains out, because it sort of felt like it was burning under my skin, and that could have just been from like the feeling of those wires getting pulled out. But other than that, I haven't had any extra analgesia compared to my like regulars. So my regular is tapentadol, instant release, morning and evening, and then paracetamol and an ibuprofen. And yeah, I'm looking forward to going home. What is that noise? Okay, I will say good night for now, and I will see you tomorrow. Bye. Hi, I'm home. So this is day 4 post-op. It is Friday. I don't know the date. I'm happy to be home, and I got my king-size bed. I got all these pillows. I'm just gonna make my little pillow fort and get comfy and hopefully have a good sleep. Hi, Fish. You miss Mummy? Yeah. Hi, Fish. Kitty. I'm feeling good. I'm actually on very little analgesia at the moment. So I just looked at my prescription, and he's only given me a prescription for immediate release tapentadol or Palexia. And so I don't have any more slow release, which is fine. I don't want to be on the painkillers for very long. And I'm actually not really in pain. It's more of a discomfort. Like, I obviously cannot stand up straight. We do not want to detach any of the new connections that he has made. And he was being very strict about that. Like, even though you might feel good, like, do not walk too much. Don't overdo anything. Just rest, because you run the risk of detaching, like, skin from the muscle or whatever. And then you'll have fluid gathering there, and then you need to have a second surgery. I'm like, oh, okay. So yeah, I have to be really strict with myself and just stay in bed and only move around to do very light duties. Oh, my baby, I've missed you so much. I kept thinking, no, So when I had the things on my legs, the little pumps that were like massaging my legs, I kept thinking, oh, Phaedria's there. I'm like, wait, no, it's just the pumps. So I'm so used to her just randomly touching me when I'm lying down, and then like I would forget the massage pump was on me, and I'm like, ooh, Phaedria. I'm like, no. Anyway, my little baby is making bread. Okay, I'm going to go cuddle my cat now, and I will hopefully put this together really quickly and put it up before the week's end. Okay, see you soon, bye. Okay, day 5 post-op, it's Saturday, 7th of May. I was planning to edit and put my YouTube video together, but I feel pretty awful. And there's been a mix-up with my pain medication, like they wouldn't release it yesterday. The pharmacist has to like call the specialist, and that's just so annoying. Anyway, so I've just been with no pain medication like 24 hours. I didn't sleep last night. Having a lot of diarrhea. I think I'm finally in a comfortable position. Got a photo. I have a lot of bruising on my breast. I have bruising all over, I just can't see it. I'm getting like, I've got more coughing fits that really hurt the stomach. And just burning sensations under the skin. So like I asked on Dr. Adrian's like support group on Facebook, like what are normal sensations to expect, because like everything I'm feeling is making me freak out that I'm breaking connections and tissue and all that sort of stuff. And one of his long-term patients says, you know, it's all normal, and like you're gonna feel burning and like sharp pinches and electric shocks and all that sort of stuff, and it's just like the nerves reconnecting and stuff. I'm like, okay, that's fine, that makes sense. I'm just hoping I'm not, you know, causing permanent damage. I'm so tired. I usually feel better in the afternoon. I'm an afternoon person, I'm not a morning person, so alright, wish me luck. Okay, so that was my pre-post-op vlogging that I got, you know, in hospital and like just when I got home. I figured I'd just keep it like with the raw details because it was just more, I guess, real life, like what you're going to expect, what you're going to experience or possibly experience, because every, I guess, doctor and hospital and individual is different. But yes, that was my journey last week. I'm also going to put together my like 1 week post-op video together shortly, and hopefully you'll see that soon. So yeah, if you're interested in following my journey, consider subscribing, click the like button, and leave a comment down below. If you have any questions, I'm totally happy to answer. So thanks again for watching this video, and hopefully I'll see you next time on Makeup and Science. Bye!